Welcome to Specialists in Plastic Surgery. My name is Peggy. I'm the patient coordinator for our office, and we have something special for you today. We have two of the Biggest Loser contestants and winners, Heba and Ed, and they're going to tell us about their experience with plastic surgery and tell us about their life, and we thought you'd be interested. We're here to welcome Heba Salama back to our practice. She is going to tell us her story because she and her husband both came here and are very famous for being losers, the Biggest Losers. So Heba, can you tell us a little bit about yourself?
Yes, thank you for having me. My husband and I lost a significant amount of weight. I lost 138 pounds over 7 months. And while I felt like that was a huge accomplishment, I still felt like I had some skin issues from losing the weight. I was a size 24. And now I'm, between a 10 and a 14, depending on what part of the year you ask me. And I just really didn't feel like my journey was complete. I had dealt with a lot of chafing when we raced, and so I actually had been recommended to go to Los Angeles and was a little nervous about traveling. And then I started asking around town, and I kept hearing Carlino, Carlino, Carlino from 3 or 4 friends, parents, different people that had come here. And so I came to Specialists in Plastic Surgery and was just delighted by everyone in the practice, you included.
Thank you.
I felt really taken care of, and I found that staying local was going to be really to my benefit because the office was right here. I was going to have my surgery here. I was going to have the surgeon and all the nurses and the staff here for me if I needed them, because traveling really just wasn't going to be in my best interest. So I came here, I fell in love with the practice, and just thought, this is what I'm going to do. And when I was, confirmed that yes, I needed surgery and it wasn't just a figment of my imagination, I would do it all over again in a heartbeat.
Well, that's great. Can you tell us just a little bit about what went on at the show?
Yes, I was the heaviest female at 294 pounds and a size 24, and I went on to win the $100,000 prize by having the highest percentage of actually any of the contestants on season 6 of The Biggest Loser, and my husband was the runner-up. So we have changed our lives, and we now do half marathons and triathlons pretty much for a career.
Well, you're a real inspiration to everyone out there.
Thank you.
Thanks for joining us.
Thank you so much.
And we're here with Ed Brantley, one of the winners of The Biggest Losers. He's here to share his experience about what he and his wife Heba did on the show and why they chose us for plastic surgery. How was your time on the show, Ed?
I was very, very good. It would have been a lot worse if Heba wasn't here with me, though.
Oh, she was there for support.
Absolutely.
Quite a team you were.
Absolutely.
So, how much weight did you lose?
I lost 139 pounds.
Oh my gosh, that's just amazing. So, with what was left over, did you have skin, or what did you feel like you wanted to do plastic surgery?
Yeah, I had what the kids today call man boobs and a lot of leftover skin.
Okay, and what brought you to Dr. Russell?
Well, Heba's, some of her girlfriends, her friends' parents had been patients of Dr. Carlino's before, so he came highly recommended.
And how was your process here when you made your appointment and did your consult? Were you pleased with everything that took place?
Yeah, it was kind of like going to a travel agency, like planning a trip to like some faraway island somewhere.
Well, good. We're so glad you're here, and we're going to continue on back with the consult and the OR through this process, and we have a lot of people very interested in what you've been up to.
Fabulous. Can't wait.
Heba, here we are in the consult room where we had our first meeting with Dr. Carlino. Can you tell me a little bit about how you felt about the consult? Were your questions answered?
Definitely. I was a little nervous coming in because I knew primarily that I felt like I had, a hanging pooch, as women call it, and I just was not sure really what I needed. I was confused about what it would look like, and I think not only did I have all my questions answered, but one of the best parts was being able to see all the pictures of all the surgeries before and after, and kind of search through the pictures and see kind of what was closest to my body type, and actually, instead of blindly envisioning results or having unrealistic expectations, I was able to see a huge variety of pictures. And Dr. Carlino talked with me about the scarring and everything, and really set up a realistic expectation for my personal surgery and my personal results, and really made me feel at ease with the whole process, because it can be really nerve-wracking. I was definitely scared and nervous. about plastic surgery in general, but I definitely left here feeling like I was 100% certain that it was the right decision for me.
So you were comfortable with Dr. Carlino. How did you feel? What were your first impressions of him?
I felt completely at ease. I definitely felt like he was taking me and all my concerns very seriously and was taking all the time that I needed to have everything answered. I didn't feel like he rushed through it. I didn't feel like he glazed over everything. I feel like he hit all the points.
Now, after you made your decision to do this, you met with Ashley, and how did the scheduling process go for you?
When we were going over scheduling, Ashley was extremely accommodating because Ed and I have very busy schedules, and she was able to get us in with a schedule that worked for us as well as recovery time. We have a lot of things going on, and we didn't have a huge amount of time to be down. And in fact, 8 days after my surgery, I was giving a speech, so it worked out perfectly.
Well, that's good. And then after you did the scheduling and she made an appointment for you for a pre-op, which was about 2 weeks before, how did you feel about that time you spent with one of our nurses in the hour-long pre-op?
Bonnie was great in my pre-op. We went through everything from the drains when I got home to any gory details that I might have not known, everything that I needed to do before, and I left with a huge information packet that I referred to at least a dozen times in my recovery and pre-surgery.
So it helped you prepare for
It was
everything.
completely helpful.
Well, that's great. Thanks. Well, and welcome back. We're in the consult room now.
Yes.
This is where I first introduced you to Dr. Russell.
Correct.
And I just kind of like to go over the consult process with you. How did you feel when I first met you and you came in and we discussed this? How was your feelings when you met Dr. Russell?
When you kind of take on a thing like this, something so big, there's so many questions, so many ideas, and so many ways that it can go. And Dr. Russell was very helpful in kind of narrowing the paths down to just a couple to make the decision-making process a lot easier.
That's right. And did he answer all your questions? And did you find him easy to talk to and he understood your needs?
Absolutely. Dr. Russell totally went above and beyond any expectations I had for a consultation of this sort.
Okay, so you left the consult and you talked to Heba because
Right.
of course you couldn't do this without Heba.
Exactly.
And she had already done her surgery at this
Right.
point,
Right.
so she was on board and you supported each other.
Absolutely.
Then the next step was scheduling it.
Exactly.
And did you have the same complications with that like Heba with your schedule?
It was just as smooth as silk, when in our scheduling world, it basically goes from God to Heba to me. And Peggy was actually able to work with that whole scheduling mess that we have in our lives. So it really just, couldn't have been easier. Couldn't have been easier.
Well, that's good to know. And then when she made your appointment for the pre-op, you came in and did you have a good hour with one of our nurses?
Absolutely. And her name was Renee, sweet as sugar, just as cute as a button, very, very knowledgeable.
And you learned so much from her that helped you
Yes.
prepare for your surgery.
Absolutely. Absolutely.
Well, we're really glad you're back and that you're telling us this story. Thanks.
Thank you.
All right, Heba, here we are in your operating room. This is one of our 2 nationally accredited operating rooms. We wanted you to come in here and see where you had your surgery, even though you probably don't remember much.
I remember it vaguely. I think I got a little tour before my surgery, and I definitely was very impressed with the facilities. You don't expect when you're walking into kind of a doctor's office environment to find an exact, pretty much a hospital setup. I felt very safe. I saw all the equipment. It's extremely clean and very well equipped.
How did you feel when you were coming in for your surgery? Did you have any anxiety? And what did our nurses do to make you more comfortable?
Everyone was really upbeat and made me really feel comfortable. I think that made a huge difference because anytime you're about to get put under for any procedure, especially elective, you just want everything to go right, and everyone was just really on top of exactly what they were doing, talked me through it that morning. I wasn't nervous at all after I finally got here and saw everybody.
Now, in our practice, we use certified registered nurse anesthetists that we call CRNAs. Did you relate well to yours? Did he listen to everything?
My CRNA put me right at ease. He, told me that he was gonna put me down with a nice cocktail, and I was definitely comfortable. I definitely had fears about anesthesia in general, and he kind of talked to me, told me exactly what he'd be using, exactly when, how long, everything, and it made me feel so much better. Not just walking in here being told to lay on the table and being put out.
That's perfect.
It was great.
So you had a good experience.
I had
And
an
then do you
amazing
remember
experience.
your recovery over in our recovery room at all?
I remember waking up and I was in quite a bit of pain, but he remedied that very quickly. As soon as I said, I was in pain, he came right over and gave me some extra drugs and, got me through it enough so that I could go right home after I woke up enough and was fine through the night.
Wonderful. Well, Dr. Carlino's here to talk to you about
Okay,
your experience, so I'll have him come sit with
Okay,
you.
thanks.
How
Hi.
are you?
Good to see you.
It's been a long road.
It has.
Well, let's talk a little bit about what you had done. You worked very, very hard with diet and exercise to lose the weight, but there are always three things. There's always skin, muscle, and fat. And unfortunately, you can't exercise the skin. So what we did was the classic tummy tuck. And the whole concept is to take the extra skin and fat away and tighten the muscles, bring them back into their normal anatomic position. So that's what we did for you. We lifted the skin and fat up, we tightened the muscles, and then we took the extra skin and fat out, giving you a nice contour to the abdomen and the hips and the lower pelvis. So what do you think? Have you been happy with the results?
I'm very happy. Sometimes I look in the mirror and I just am kind of shocked that I have such a nice stomach. It's how I felt before, but not how I was seeing it translated into the mirror. And now I feel more fit because I worked so hard, but I was still seeing this hanging stomach, and it was very frustrating. Plus, when we race, it was causing a lot of chafing, which is extremely uncomfortable. And now there's none of that.
Right. Unfortunately, you can't exercise the skin, and sometimes the only option is surgery. Well, let's take a look at your before and after pictures. I don't know if you've seen these. But
Wow.
you can see here the belly button acts like a rivet or a screw in the middle of the abdomen, and so it holds everything above, so you have the draping of the skin over it. But typically with weight loss or pregnancy, there's problems with redundant skin both above and below the belly button, in the inguinal areas, and the pubic area as well. And by releasing the belly button as part of lifting up all this soft tissue, what we did was we were able to get to the deeper structures, the muscle, and we were able to tighten the muscle all the way from the breastbone down to the pubic bone, giving you some good strength and continuity of the abdomen. We then pulled all this down to take out the extra skin and fat, and you can see you have the incision which runs from hip to hip and a little bit around the belly button. We actually get better definition, a little bit of hooding to the belly button. By pulling down and out, we were able to pull up and in the groin areas, and actually makes the inguinal crease much more smooth and youthful looking, as well as tightening the waist here. You can see from the side view, there was so much skin redundancy that it just kind of enveloped down and cascaded down the abdomen, and now we have a really nice tight flat abdomen. The trade-off clearly is the scar that goes from hip to hip, but in looking at the contour, we even got the flanks and part of the back. It's a dramatic difference that's well worth the trade-off for the scar. And finally, in the oblique, it kind of puts it all together, where you can see both improvement in the waist, the upper abdomen, the lower abdomen, the inguinal areas, the pubic area, and really the central abdomen just recontouring and getting much more normal anatomy.
My goodness.
That's why we take before and after pictures with all people, because it's amazing how quickly we can forget.
I definitely forgot. It's pretty amazing. Definitely good results. I think I was hesitant at first, but looking at those pictures makes me remember that I definitely would encourage anyone that lost a lot of weight to consider letting this be the final step, because you're right, and sometimes you just need to go and have a doctor tell you that this is skin and it's not going to go away.
It really is the icing on the cake.
It was great.
Well, we're thrilled that you're happy with the results.
Thank you so much.
I know that people will want to hear more about your recovery experience after surgery, so Peggy's going to talk to you a little bit more about
Okay,
that.
sounds great.
Thanks.
Thanks.
We are back in the operating room, and I know you don't have too many memories of it in here.
Kind of cloudy, yeah.
Kind of cloudy. Can you tell us how you felt when you came here for your surgery in the morning? Did you have anxiety or anything like that?
Yeah, I think most people's experience with an operating room is what you see on TV, and it's like stainless steel looking and cold and kind of weirds you out. But this is very kind of a warm, kind of open environment.
Well, when you first came here, you went in our little pre-op room and you met with one of our certified registered nurse anesthetists.
Correct.
How did you feel? How did you relate to your CRNA?
He was very helpful in making me understand the process that you go through to endure a surgery like this under anesthesia and what it takes, the timing of the certain drugs and things like that to keep you sedated, to keep you under, and to make sure you're okay and safe.
And how are the nurses? We have 2 nurses back here. Did they take good care of you?
They were very helpful. They just kept talking to me, kept my nerves calm,
Good.
asking me questions about cooking and this and that until I was out like a log.
And that's all you remember?
That's all I remember.
Okay, then you came from here and you woke up in the recovery room. Do you remember waking up in there?
Not really, not so much, but what I can recall, I remember seeing Heba there waiting to roll me on out of here.
That's wonderful. You had the support. You both went through the same thing.
Absolutely.
Well, Dr. Russell is here to talk to you about your results and show you
Fabulous.
some of your pictures. So,
Right.
Dr. Russell?
Dr. Russell, how are you?
Good to see you.
You too, thank you.
When you and I first met back in about September 2009,
Right.
as I recall, you were about 6 months from the show,
Right.
and you had told me that you had lost about 110 pounds through the process of going through the diet and exercise that was based on The Biggest Loser.
Right.
So you went from about 350, as I recall, down to about 240.
Right.
And at that point, what things were bothering you that you felt like you had not been able to address with the diet and exercise?
Well, you work out so hard, and it was just frustrating to have these man boobs and all this skin jiggling around still after I had worked so hard to get rid of that, to get away from that.
Right. And as you found out, you did a great job with the weight reduction. It was commendable the way you did that, but that you found that there was some skin and some fatty deposits that just hadn't responded to the diet and exercise.
Right.
Let me go over some pre-op photographs with you. You may not remember this because it's been a while since we did this, and show you where you were at the time we first met. But here was the first one before we did the surgery. And you can really see here from the side the fatty deposits that you had in the breast area.
Right.
And the redundancy of your abdomen and the fatty deposits along your flanks.
Right.
And so we decided to do 2 things. We did liposuction of your breast area to try to reduce the size of that. And then we did a tummy tuck and abdominoplasty combined with some liposuction here in the flank areas.
Right.
You probably remember in the preoperative area that we met and we talked about what we're going to do, we did some markings.
Right.
And marked here in the breast area where we were going to do the liposuction.
Right.
And that was done through some small incisions here in the axillary areas, which you really don't see. And all we did was the liposuction. There was no skin removal, and you can see how nicely that was contoured. The markings we did for the abdominoplasty, there's an incision that goes right along the pubic area, and I was able to use this lower line right here. And after freeing up this excess skin and fatty tissue, and lifting it up and pulling that down, I was able to actually remove all this tissue all the way above the umbilicus, the belly button. So this much was removed. And you can see here, that was a tremendous improvement in the contour of your abdomen. These photographs were taken at the last visit that you and I met, which was at 3 months after surgery.
Right.
And so the scars are usually still a bit pink or red. And I assume that since then they've continued to fade some.
Correct.
Okay. And here again are the pre and post-op photographs. So you can really see the definition here in the breast area and how much better that is. This is a very normal appearance now, and is a real reward for you after having lost 110 pounds and not being able to get rid of this, but with some body contouring, it did an amazing.
Yeah, I mean it's visually I can't believe it. It just is amazing to see the transformation there. It's unbelievable.
You did great with all this. Tell me about the process going from the time we marked you for the surgery and did the surgery, and then 3 months later, how did you feel through that whole period?
The first couple of weeks after is a little rough with the drains and things like that, and it takes a little coordination and just patience to kind of deal with that. But after those drains come out, I was just ready to go to the gym, business as usual. Of course, that's not the reality. You have to give it a little bit of time, but things really progressed very well because our healthy status. You take care of yourself and your body heals and regenerates very, very quickly.
Well, we try to help patients along to make sure that things do go well, and as I recall, you really had no problems at all with the surgery and sailed right through the recovery period, and here you are.
Yep, just sailed right through it. Yep.
Good. Well, it's been good to see you again.
Thank you very much, Dr. Russell.
And look forward to seeing you.
Thank you. Changed our lives. Thank you very
Right,
much.
well, I'm glad to hear that. It's very gratifying to see what happens to someone like you.
Thank you. You're a big part of it. Appreciate it.
Okay, Heba, can you tell us a little bit about your recovery and how the nurses took care of you?
Sure. From the minute I was actually coherent enough to be wheeled down to my car, someone saw me to the car, helped Ed get me into the car. We left with really specific and detailed instructions, and they even sent me home with a catheter so that I didn't even have to get up in the night to use the restroom, because it's really hard that first 24 hours after surgery. We had a phone number to call at any time, and we had a list of the drainage instructions and everything, how to keep everything clean, because it's really tricky and neither of us are physicians. So we weren't scared, we had everything we needed, and we spoke to a nurse every single day during my recovery.
That's the way we want you to feel. We want you to know we take full care of you. Now, when you came in for your post-op appointments, how did those go?
They went great. I mean, everything was moving along perfectly with my recovery because I think we had the support and education at home that I needed. So when I came in here, there were no surprises for anyone, me or the doctor.
Now, how long after your surgery did you get back to get into your regular activities?
8 days after my surgery, I was actually the keynote speaker at a charity function. So I was pretty quick to get back into my real life. But, I didn't work out for about 8 weeks. So that was like the full extent of my recovery. But on the 8-week mark, I ran a mile, and that was Thanksgiving morning. So I was fine.
And speaking of running a mile, I heard you were in something like 10 in 2010.
Yes,
Can you tell me about that?
Definitely. We're doing 5 half marathons and 5 triathlons this year. And I completed my first half marathon on February 28th, which is, I guess, just about 3.5, 4 months after my surgery. And since then, I guess I'm going on my 4th race of the year next weekend. So I don't really waste too much time, but we're having a great time.
That's fantastic. You're an inspiration to everyone.
Thank you.
And you have a huge following. Everyone knows
I
what you
know,
guys
we
are
can't
up to.
get away with anything.
Yeah, but one question I have for you is, did this change you physically and emotionally, getting the surgery and all the things that you went through?
The surgery has actually really made me feel more confident. I was really confident in myself even when at 300 pounds, but after I lost the weight and still had the skin, it really hadn't clicked in my brain that I was like this fit, healthy person. And now that I don't have hanging skin and rolls on my stomach when I race, in these outfits, I actually feel really confident, and I don't have to worry about sucking it in for pictures or trying to wear a garment to make myself look flat, because that was really hard when I'd get these pictures back from races and see just gobs of skin hanging out. So now, I cross the finish line with great pride and my arms up, and I'm not nervous, and I know all the pictures are going to come out great.
That's
So
fantastic.
I think it's the final step for people that have lost a lot of weight and can't get rid of the skin.
Thank you so much for coming and
Thank
sharing
you.
your story.
Thanks.
You're welcome. Okay, Ed, could you just tell us a little bit about your recovery and how long it took to fully recover?
Yeah, full recovery took me about 6 weeks. After I was wheeled out of the OR, Heba was ready, waiting for me to get me in the car, and of course the staff here helped me into the car as well. But it was just a very easy recovery.
And how about, Heba told us how the nurses were with her, with checking in regularly.
Right.
Did you have the same experience?
Absolutely. I mean, just layers upon layers of checkbacks and appointment making, just to make sure everything was good, was working like it was supposed to.
And your post-ops went well?
Absolutely perfect.
Well, has this changed your life at all?
Yes, I'm sure you know we've had many life-changing experiences, but this is just really the icing on the cake. You know, sometimes when you go through an ordeal like we did, it's hard for the mind to catch up with the body. So this really helped give us a jump start with that.
And would you recommend Dr. Russell to your friends or any other one else on The Biggest Loser?
I would recommend no one else but Dr. Russell for something like this.
Well, we really appreciate you sharing your story. Thanks for joining us.
It is our pleasure. Thank you.
You're welcome.
We definitely feel like we made the right decision to have our surgery not only locally but at Specialists in Plastic Surgery. The recovery was amazing. We always had a phone number to call, a nurse to call. We could come right to the office if we needed to, and it was definitely the best decision for the end of our journey. Wouldn't you say?
Absolutely. Very professional doctors, staff, everything, and I think that's what makes the difference. You know, knowledgeable people who care about what they do.
Yeah, I mean, we definitely had shopped around, and this was definitely, without question, we didn't really have to think about the decision to do it at Specialists in Plastic Surgery in Raleigh at home, where we knew we were going to be taken care of. So I would recommend it highly to anyone who is on the fence. If you're not sure, at least come in and have the consultation, because once we did, it's like a total life changer. Your clothes look different, you feel better, your mind starts to match up with your body and the things that you can do, and it just makes a huge world of difference. So thank you very much, Specialists in Plastic Surgery.